Let me say good evening to everyone on tonight. We will now call to order the Muskogee Municipal Authority meeting for today, December 14th. Roll call.
Mayor Marlon Coleman.
Here.
Deputy Mayor Derek Reed.
Here.
Ivory Van. Jamie Stout.
Here.
Evelyn Hibbs.
Here.
Alex Reynolds.
Here.
Stephanie Morgan.
Here.
Tracy McGee.
Here.
Tracy Hoos.
We will now consider item number 1.
Consider approval of MMA minutes for November 9th, 2020.
We've all had an opportunity, I hope, to review the minutes. Do we have any corrections or motion?
Move for approval. Second.
It's been properly moved and second. Any discussion on the minutes? Roll call.
Tracy McGee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs. Jamie Stout.
Yes.
Deputy Mayor Derek Reed.
Yes.
Mayor Marlon Coleman.
Yes. Item number 2.
Consider approval of MMA claims for the month ending November 30, 2020.
We've had an opportunity to review the claims. Do we have any questions from the council or motion to approve?
Move for approval.
Second.
Mr. Miller, anything to add? Are we good?
We're good, thank you, sir.
Roll call.
Tracy McGee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs.
Yes.
Jamie Stout.
Yes.
Deputy Mayor Derek Reed.
Yes.
Mayor Marlon Coleman.
Yes, that will conclude the MMA meeting. We will now call to order the Muskogee City Council meeting for today, December 14th. We will have the invocation and the flag salute. Let us stand. Let us pray. Dear Lord, we thank you for tonight. Father, I want to give a special thanks to you for allowing this council to be assembled and work together for their kind gifts to our employees on tonight. I pray, oh God, that their consideration for others may return unto them twofold and abundantly over. I pray your blessing, oh God, upon our community. Lord, as we struggle with the effects of COVID-19, Father, that you will bless those who stand in the need. And Lord, that you'll show us ways through your wisdom to bless our community. I pray, oh God, that you send us jobs, send us opportunity, send us everything that we need, oh God, that we might be blessed. In Jesus' name we pray. Amen. Join me in the flag salute. Attention, salute, pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Before we go into the agenda any further, we need to have a motion to excuse Councilors Ivory Van and Tracy Hoos.
Move to approve.
Second.
It's been motioned and second. Roll call.
Tracy McGee.
Here.
Yes.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs.
Yes.
Jamie Stout.
Yes.
Deputy Mayor Derek Reed.
Yes.
Mayor Marlon Coleman.
Yes. We will now have approval of the minutes for the special call city council for November 16th and city council regular session November 23rd. Do we have any corrections to the minutes or a motion to approve?
Move for approval. Second.
It's been properly moved in second. Any further discussion? Roll call.
Tracy McGee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs.
Yes.
Jamie Stout.
Yes.
Deputy Mayor Derek Reed.
Yes.
Mayor Marlon Coleman.
Yes. We will now consider the consent agenda, which consists of items 1 through 9. Are there any agenda items that need to be moved to the regular agenda, or do we have a motion to proceed?
Move for approval. Second.
We have a motion and a second to approve the consent agenda. Any further discussion? Roll call.
Tracy McGee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs.
Yes.
Jamie Stout.
Yes.
Deputy Mayor Derek Reed.
Yes.
Mayor Marlon Coleman.
Yes. Item number 10.
Receive report and recognition for City Council and Council appointees diversity training.
Councilor Stout.
Our guest is not able to be here tonight, so we can move this off the agenda.
Thank you. Item number 11.
Receive report on the COVID-19 pandemic in Muskogee, and if necessary, take appropriate action to authorize and approve a subsequent amendment to Resolution Number 2801, declaring a local emergency, or City-County Joint Resolution Number 2803.
Mr. Miller.
Yes, thank you, Mayor, members of the council. Times are changing, and we are seeing a new phase in our fight against the coronavirus and COVID-19. One of the important phases that we're entering now is that of the vaccine timeframe. You saw the news probably over the weekend that trucks are being sent out all over the country delivering first doses of the vaccine to various parts of the country. Oklahoma has rolled out its plan for how that will be implemented here. Again, that's the state's plan, not the city's plan, but I sent that to you guys last week, and we'll discuss it in some detail today. Tyler Evans is here and will give you an update, and Doug Walton from the Health Department is here to help explain from the state's perspective what that vaccination rollout looks like. And we want to give you guys the latest information. Again, this is just really a pass-through of information to you because there's a lot of hard decisions that get made when we talk about this vaccine, and none of those decisions are made at our level, and we don't necessarily have influence on those, but we want to try and make sure that the right information is getting out there. Mr. Evans, go ahead.
Thanks, sir. Good afternoon, Mr. Mayor, members of council. In front of you, you have your data packet that you're used to seeing. We'll go over some facts real quick concerning the packet and go on to talk about some other points in this discussion. As of today, the city of Muskogee has 593 active cases of COVID-19 and city limits. This is up from 375 active cases 1 month ago. For the state of Oklahoma, 4% of ICU beds are available, 16% medical surgery beds, and 67% of operating room beds are available. At the bottom of the first page there, you see the ICU bed availability chart I've been keeping track of. About 2 months back, we're at 12%, and as of today, the states are reporting, the state is reporting 4%. If you flip over to the second page, it says city-only data. We've talked about keeping track of the cases per 100,000. The state has been keeping track of the counties for a while, but we really needed something for the cities. So this is something that I've started tracking a little over a month ago for the city data for cases per 100,000. As you can see, we're at 132 cases per 100,000 as of today. We're averaging over a 7-day average 49 new cases of COVID every day in the city of Muskogee. Unfortunately, we're up 11 deaths related to COVID-19 from 1 month ago. On the following page is that COVID alert system that the state started that has your yellow, orange, and red cases, or red counties. As we can see, every county in the state of Oklahoma is 130 is orange, and Muskogee County is at 130.7. Included in your packet is information that you guys are used to seeing, reports from our weekly epidemiology report. The Washington COVID Task Force report is also included in there. But with you on a separate packet, you should have the COVID-19 vaccine priority population framework for Oklahoma. This is what's published by the Oklahoma State Department of Health, and we'll kind of outline, how the vaccine is going to roll out, who gets what first, so on and so forth. But before I talk on that, I would like to introduce Doug Walton from the Muskogee County Health Department, who may have a little bit better insight and answers to some questions regarding this framework, since it is the Department of Health's. Doug?
Yes, hello. Thank you, Tyler. Mayor and council, good to be with you this evening, and just kind of a follow up on Tyler's comments initially on the cases. We are seeing kind of an increasing daily count of new cases within the city and within the county. 72 new cases reported today, 143 yesterday, 81 Saturday in the county. So definitely, reasons to remain as vigilant as possible in all of the measures that we've been discussing throughout the pandemic, and the importance of masking around those outside your household or even within, if you're quarantining or isolating, the social distancing. Remember, the definition of a close contact is 15 or more minutes at a distance of 6 feet or less. And so trying our best to minimize both of those, even with masks on, is the ideal scenario. And then, of course, the frequent hand washing throughout the day, all really, really important to continue with as much vigilance as ever. So I know that you received the copy of the COVID-19 vaccine priority population framework for Oklahoma, which lays out the proposed phasing of the distribution of and administration of the COVID-19 vaccination. I know this is kind of the current plan, but I also know that there are a lot of moving parts, and predominantly the volume of vaccine that is received by the state and the timing of those deliveries. You may have heard that the state of Oklahoma received 33,000 vaccines today for initial distribution, and today at the governor's press conference, they announced that 7,800 of those were going out through Integris and their health system and network, sort of a hub and spoke system of delivery and distribution, and then another 9,750 vaccinations to St. Francis for distribution, and those would be for your frontline healthcare workers that are providing or supporting direct care for people with or possibly with COVID. Also in that phase one of the distribution, which we're now in just initiating, vaccines will be going to long-term care residents and staff, and that's going to be coordinated through the federal pharmacy partnership program that's being set up through the Centers for Medicare and Medicaid with the two national pharmacies, Walgreens and CVS, for distribution to those facilities. And then also in the phase one of distribution, that'll include frontline public health staff, such as the nurses and others, clerical staff who come in contact with clients and patients at health department and other similar facilities. And then also within that phase one will include Oklahoma state licensed emergency medical technicians and paramedics who are providing the direct care and transport and transfer of patients with or suspected with COVID. Within that report, you'll notice estimated numbers within each of those categories. In phase one, those total up to 157,900 estimated individuals who would be eligible to receive those vaccinations. So we know we are expecting, the state is expecting approximately 166,000 vaccines to come in this month to the state for distribution through to and through these organizations in this phase one. So that kind of comes back to the point as as they come in, they will then be put into the system for getting into the proper hands for distribution. Phase two, which is estimated to begin as soon as January, assuming the vaccines continue coming as they have begun. Those will include basically other first responders that are not in direct care of COVID or suspected COVID individuals, and as well as the healthcare workers providing outpatient care and services, and basically additional hospital staff that may not be frontline but still at risk, as well as those in urgent care and other facilities, and those involved in the funeral industry. And that's an estimated population of approximately, well, there's more, I guess, still within there, adults age 65 and older, large group, estimated to be at 635,000 itself, staff and residents in congregate locations, work sites, quite a few other, folks in there that are in close quarters with individuals who may, have or be at risk for having COVID, and then other public health staff that are not directly frontline but supporting frontline workers. What I did hear is that it's even possible that there could be some activity involving phase 2 even before phase 1 is entirely completed. I don't know the certainty of that, but just I think again indicating the fluidity of everything and depending on the timing and availability of the vaccine. The third phase is really considered right now teachers, students, residents, and administrative staff in K through 12 and other school settings, child care facilities, et cetera, critical infrastructure personnel. We had a list early on in the pandemic indicating all of the different entities that were considered essential infrastructure. That's a huge population, as is the teacher, student, and other staff population, both over 1 million. And then general public, all Oklahoma residents in phase 4. Of course, the reason that these have to be prioritized in such a way is to first address those that are at the greatest risk, also recognizing that the availability of the vaccine, will not be all at once and will be spread out over time. I believe that's really about all that I wanted to share about that specifically. I'm sure there are questions and there may be something that I meant to address that'll come out through a question, but I think that's just wanting to make sure you had this document and that you had a chance to at least discuss it or ask any questions about it. I remember. I am not an immunization or vaccination specialist or expert. I am learning as we go as much as I can. I may very well not know some of the things you're wondering, and if I don't, I will do my very best to find out and get that information back to Mr. Miller.
Thank you, Doug. That concludes our update. If there's any questions, I'd like to address those.
Do we have any questions for the floor on tonight?
If not, I'd like to turn the floor back over to Mr. Miller. Thank you.
That concludes our report. Aside from this one last thing, just the council did want to point out what Doug said, which is our police and fire would fall into phase 2, as would senior state, county, and city government leaders and elected officials, who's crucial to the continuity of government, which is the council, also in phase 2. So I just wanted to highlight those. I think Doug did say that. So that being said, we've nothing else to add at this time.
Thank you. Do we have any questions from the council before we proceed to the next item? Thank you, Mr. Miller. Item number 12.
Consider approval of claims for all city departments November 7th, 2020 through November 27, 2020.
Mr. Miller.
Yes, this is just an administrative procedure right here. Usually we have these on the Finance Committee, and somehow we neglected to do that last time, so usually it'd be on the consent agenda. In this case, it's going directly to council. It was approved in Purchasing Committee a week ago, and staff does recommend approval of claims.
Move for approval.
Second.
We have a motion and a second. Any discussion regarding the claims? Roll call.
Tracy McGee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs. Jamie Stout.
Yes.
Deputy Mayor Derek Reed.
Yes.
Mayor Marlon Coleman.
Yes. The item passes. Item number 13.
Consider approval of an amendment to the current prescription benefit services agreement with Caremark LLC, Caremark PCS Health LLC, to accurately reflect the city's plan design requirements for the prescription drug benefit program to be administered by CVS Caremark or take other necessary action.
Ms. Plunkett.
Mr. Mayor, members of the committee, the City Council, excuse me. House Bill 2632 prohibits our pharmacy manager from driving employees to utilize certain pharmacies. Currently, we have specialty pharmacies that our employees can utilize. Effective on January the 1st, we can no longer drive our employees to those pharmacies. So, therefore, we do need a plan amendment to change our plan so we can follow the law. And again, this is 2632 House Bill. This has gone to the Insurance Committee. They are recommending approval. Staff recommends approval, and I'm happy to answer any questions.
Do we have any questions for Ms. Plunkett on tonight?
Move for approval.
Second.
We have a motion and a second. Any further discussion? Roll call.
Tracy McGee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs. Jamie Stout.
Yes.
Deputy Mayor Derek Reed.
Yes.
Mayor Marlon Coleman.
Yes.
Thank you.
Thank you, Ms. Plunkett. Item number 14.
Consider approval of change order number 4 for McGuire Brothers Construction for water distribution improvements, 30-inch water line project, or take other necessary action.
Mr. Stewart.
Yes, this change, Mayor and Council, this change order is for $2,437. And it also adds 15 days to the actual contract. And by the way, this contract with McGuire Brothers on that 30-inch water line is way ahead of schedule. So the original completion date was January 5th, and this will push it to the 20th. And if we have good weather, they'll still be on time. But what this change order before you is for is it was left off of the plans. There's a blue building out there on Old Shawnee that is west of the railroad tracks. Used to be a bar. And that place was disconnected when we're hooking the 24 into the 30-inch. And what this does is this allows us to hook that back up into the 30, or actually it's going to hook back into the 24, just in a different place. So it was left off of the engineering set, and it needs to be done, and we recommend approval. I will answer any questions. But again, this project is well ahead of schedule, so these 15 extra days probably won't be needed, but they are allowed. And by the way, 10 of them is because they need to have parts delivered, and they had to order the tapping saddle for that line. And that's an extremely large line, is why it has to take that long. Recommend approval.
Do we have any questions for Mr. Stewart on tonight? Or
Move for
motion?
approval.
Second.
It's been properly moved in second. Any further discussion? Roll call.
Tracy McGee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs. Jamie Stout.
Yes.
Deputy Mayor Derek Reed.
Yes.
Mayor Marlon Coleman.
Yes. Item number 15.
Consider approval to accept a bucket brigade grant from Georgia Pacific in the amount of $2,000 to be used by the Muskogee Fire Department or take other necessary action.
Chief Jones.
Yes, Mayor and Council, we were recently awarded a grant from Georgia Pacific, their leadership team, in the amount of $2,000. The grant is to be used for maintenance and operation. They were very appreciative of our efforts to extinguish their fire out there last year. I think it's a good grant. It'll help us out a lot. I recommend your approval. Be happy to answer any questions.
Do we have any questions for Chief Jones tonight, or do
Thank
we have a motion to approve?
Thank you, Chief. It's always great to see our community stepping up and partnering with us and helping out. I move for approval.
Second.
It's been properly moved in second. Any further discussion? Chief Jones, let me add those sentiments. Thank you for your leadership and being certain that we continue to have these additional funds.
Yes, thank you.
Roll call.
Tracy McGee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs.
Yes.
Jamie Stout.
Yes.
Deputy Mayor Derek Reed.
Yes.
Mayor Marlon Coleman.
Yes, the item passes. Thank you. Item number 16.
Consider approval of resolution number 2843 in support of local business, waiving certain city business license fees for fiscal year beginning July 1, 2021, or take other necessary action.
I'd like to make this recommendation to the council. We know what's going on across our country in terms of the delays in getting the necessary relief funds to our state so that they can in turn support our local businesses. What this does is waive certain fees for one fiscal year only pertaining to businesses in the city of Muskogee. Those fees can be listed on page 59 in your packet on tonight. It gives the list of those types of companies that would be waived that fee for 1 year, as well as examples of those businesses next to it. Particularly, we highlight the business example for Holy Smoke Barbecue as a small independent restaurant, food, 5 employees or less, $20. In communicating this idea with several of our smaller businesses here in the city of Muskogee, for a lot of our small restaurants in particular, especially those independent ones that are not chains, $25 or $50, sometimes even $100 makes a huge difference in their cash register. And so certainly we know that it's not enough to do the type of relief that our businesses deserve, but I think as a council, it is incumbent upon us at this time to at least make the gesture that we are interested in supporting them any way that we can. We have been visiting on this item with Mr. Miller and Mr. Tucker, who were agreeable to this. This is a total of about $20,000 to the city that we believe will be made up through a combination of sales tax and use tax as our numbers continue to tick up in those two particular areas. Certainly as a council, if we had the might of the state legislature or the federal government, we would probably do more. We would do what we can to support our small businesses, but this is the best that we can do at this time. And again, this recommendation is only for 1 fiscal year. We are hopeful that as the vaccine is distributed and that as Congress hopefully reaches some type of compromise to be able to extend funds to our businesses, that this type of incentive and relief may not be necessary again. But until it is necessary in the interim, certainly we want to do what we can to help our small businesses, our local businesses, by this gesture to showcase to them that we are concerned about their plight. And that would be my recommendation, but I will gladly entertain any conversation from the council at this time. Or a motion.
So moved. I make a motion.
It's been moved by Councilor McGee. I'll second that. And if we have any other further discussion from the council at this time concerning providing relief to our local businesses.
Mayor, just to clarify, the businesses, even though the fee's waived, and this is articulated in the resolution, the license will still need to be obtained. There just won't be a fee associated with that, just to ensure that those who may qualify and who may be listening at home realize that when they receive the paperwork from the city reminding them for the renewal, they will still have to renew the license. There just won't be a fee associated with it.
Thank you, Mr. Tucker. And also to remind us again, this is only a one-time consideration. We hope that by the time it becomes renewable in 2022, we will not be having to have this conversation. Further discussion? Roll call.
Tracy McGee,
Yes.
Stephanie Morgan,
Yes.
Alex Reynolds,
Yes.
Evelyn Hibbs,
Yes.
Jamie Stout,
Yes.
Deputy Mayor Derek Reed,
Yes.
Mayor Marlon Coleman.
Yes, the item passes. We don't have any citizens signed up to speak on tonight, but before we go into our executive session item, I want to take this time to personally recognize the members of the City Council who took the initiative to be certain that we were able to provide for our city employees with the food baskets that we gave to them on tonight. We were not able to give them everything that we thought they deserved, but certainly a food basket goes a long way. When we were there earlier, some of the council members had been there for a couple of hours already, putting baskets together and also handing them out. And I can tell you that by the time I arrived on tonight, the smiles and the warmth from the city workers was an expression of their appreciation. And I would be remiss if I did not take this opportunity to thank the council for their effort, for their volunteerism. Certainly when we are done with the executive session, They're still handing out those boxes. We are headed back to the Civic Center to take care of our employees. And I also want to remind the community that's watching that on tomorrow at 12 noon, there will be food boxes given away at the Minimax grocery store on Shawnee, and they will need volunteers to arrive there at 11:30. These are tough times for many of our residents. There are people who are receiving food boxes we could not imagine would be even in line to get one, but people are hurting. And any way we can help our community, certainly we ask all of us to do that. Item number 17.
Consider an executive session to discuss and take possible action on the following. A, pursuant to Section 307B4, Title 25, Oklahoma statutes, consider convening an executive session to discuss the workers' compensation claim of Mark Etchison, and if necessary, take appropriate action in open session. B, pursuant to Section 307B4, Title 25, Oklahoma statutes, consider convening an executive session to discuss the pending tort claim of Linda Campbell, and if necessary, take appropriate action in open session.
May we please have a motion to go into executive session?
Move for approval.
Second.
Roll call.
Tracy McGee,
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs.
Yes.
Jamie Stout.
Yes.
Deputy Mayor Derek Reed.
Yes.
Mayor Marlon Coleman.
Yes. Those who do not need to be here, will you please excuse us while we go into executive session at this time? We will now reconvene from executive session. Roll call.
Mayor Marlon Coleman.
Here.
Deputy Mayor Derek Reed.
Here.
Ivory Van. Jamie Stout.
Here.
Evelyn Hibbs.
Here.
Alex Reynolds.
Here.
Stephanie Morgan.
Here.
Tracy McGee.
Here.
Tracy Hoos.
Mr. Tucker.
Thank you, Mayor. Item 17A, pursuant to Section 307B4, Title 25, Oklahoma statutes, the City Council did convene an executive session to discuss the workers' compensation claim of Mark Etchison. After being briefed on the status of that claim and the negotiations relating to settlement, I believe an appropriate motion would be to approve authorizing the city attorney to settle the workers' compensation claim of Mr. Etchison in the amount discussed in executive session.
Do we have a motion?
Move for approval.
Second.
Been properly moved and second. Roll call.
Tracy McGee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs.
Yes.
Jamie Stout.
Yes.
Deputy Mayor Derek Reed.
Yes.
Mayor Marlon Coleman.
Yes. Mr. Tucker.
Thank you. Item 17B, pursuant to Section 307B4, Title 25, Oklahoma statutes, the council did convene an executive session to discuss the pending tort claim of Linda Campbell. After being briefed on the status and the facts and circumstances surrounding that claim, I believe an appropriate motion would be to approve authorizing the city attorney to settle the tort claim of Linda Campbell in the range discussed in executive session, and further to authorize the filing of a friendly suit for the same.
Do we have a
Move for
motion?
approval.
Second.
It's been properly moved and second. Roll call.
Tracy McGee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs.
Yes.
Jamie Stout.
Yes.
Deputy Mayor Derek Reed.
Yes.
Mayor Marlon Coleman.
Yes, that concludes our agenda for tonight. Let me say to all of our citizens, you will not see us again in this setting until January. So we want to wish you all a Merry Christmas and a Happy New Year. Encourage everyone to be safe. And again, I want to thank the City Council for their labor of love and sacrifice up until this point, and we're looking forward to even better times in 2021. We are adjourned.